we are doing a left side cervical sympathetic block, otherwise known as a stellate ganglion block or neurosympathetic reset. What I'm doing right now is just taking a look with the ultrasound. So we'll look for a few minutes and map out the anatomy, identify the nerve in question that we need to target, as well as the surrounding structures.
Are there any side effects?
When we're putting a bunch of anesthetic into this area, it's going to affect the surrounding tissues and the nerve that we're targeting. And so there'll be numbing effects in this area. There'll be warmth, congestion, a droopy eye, sometimes numbness in the vocal cord, which can make you hoarse for a couple hours. But all these effects are very temporary and expected. And in fact, they tell us that we had a good block when we see some of them because we know that nerve is turned off. So you asked earlier who a candidate is for this type of treatment. It's a great question. So patients that have symptoms of sympathetic overactivation. Now what that means is symptoms like restlessness, insomnia, hypervigilance, panic attacks, chronic anxiety. These are symptoms that are occurring because your sympathetic nervous system is over responsive to its environment. It's telling you that there's a constant threat even when there is none. And by lowering that activation through this treatment, you can integrate other more helpful treatments like therapy and mindfulness practices more effectively. And that's what makes this such a breakthrough treatment. So that needle's out. Flush.
Flushing?
We're going to pause momentarily and move on to the second and final spot. We do 2 spots along this cervical chain because it's a more effective block by targeting the upper cervical ganglion at C4 as well as the stellate ganglion at C6. Studies show that the benefit increases and maintains longer. Julie, we're going to be done in about 3 seconds.
That's
2,
it.
3. That's it. Medicine's in. We're all done. Needle's out.
That's it.
You did great. How do you feel? You feel okay?
I feel great.
Awesome.
And that didn't hurt at all.